All righty. Welcome in, everybody. So glad that you are here. Welcome to this month, being May, Lunch Bunch, HR Lunch Bunch. We're glad that you're joining us, whether you're live and in person with us right now. I always say that we're not really in person, we're virtual, but you're live in real time. And there will be many of you who are going to re listen or listen to this on demand. So we welcome you in as well. And I always let people know we will provide a copy of the PowerPoint post program. I send that out. We'll also send you a link to watch the recording later. So if for some reason you don't get those, let us know and we can make that available to you. When it comes to who I am, if you don't know who I am or have not been part of HR Lunch Bunch, my name is Deborah Jeffries. I do serve as the Vice President of HR Answers and have for a number of years. My This is kind of a in some respects, HR Lunch Bunch is a bit of a pet project. It did not start with me as one of our staff members, but I picked it up and we do virtual now thanks to a little thing called the pandemic. So people from around the country actually have joined us for the conversation. And I do want you to hear that word. It's intended to be a conversation. There is no doubt that myself and or when we have a guest like we do today with Michelle Martin from Canopy, that we have some information. We have some thoughts and observations for you. We also try and build in some questions so that you can answer and network with each other and learn from each other. Things that have worked, things that have been kind of oopses, your experiences, please bring that to the table. Oftentimes, many of us have gone to lunch meetings, conferences, and we don't always get to have as much in depth kind of connection. You have the chat box open. Please feel free to use that as well. So, couple of guidelines for you in terms of information. If you want to put your cameras up, please feel free to do that. If you want to use the chat box, please feel free to do that. Really, this is an opportunity to learn, network, and share. So, with that said, I want to go ahead and get started. Typically, from an agenda standpoint, I share some of the housekeeping stuff, and our conversation today is around workplace well-being and the use of EAPs, which is a vital, I would tell you, a necessity in terms of how we can support not only the organization, our leadership, our employees, and every now and then. Just recently, I had a conversation with one of our clients, and I said, I think I might have referenced maybe your EAP and being able to support her. And she goes, oh my gosh, I forgot to do that. And I
Mm.
said, I get it. And I said, that's where my head goes because not only will I think it address these things, but it can address other things. And she then knows that you're providing support in a variety of ways. So, with that said, we have a guest here today. Her name is Michelle Martin. This is not the first time that Canopy and HR Answers have worked together or that Michelle and I have not worked together. We have worked on blog posts together, and you are in for an informative conversation as well as someone who's been doing this for over 20 years and knows how things work. And I wouldn't bring Canopy to you unless I thought they were a wonderful resource. We have them help us with clients who are calling with extreme emergency situations, even on a weekend, and have been able to connect and get the client taken care of come that Monday morning. So when I tell you they come with not only expertise and support and ideas and suggestions and a fabulous website, I'm not joking. And yet I also know that EAPs are something that maybe not all of you have, but this is an opportunity to have a conversation, especially with May being Mental Health Awareness Month. And there might be some opportunities for you to be able to share ideas and suggestions inside the organization or perhaps start some things. And I will tell you that the blog post that I've written on Friday, that comes out on Friday, will also have a calendar of activities and ideas and suggestions for you as well. So, with that said, Michelle, I'm going to turn the conversation over to you. I will,
Hi.
if you'd like to do more of an introduction, please do. And I will keep a little bit of an eye on the chat box if people have got comments that are in there that we want to use.
Yeah.
So, welcome
Thank
in. Glad that
you.
you're here.
Yeah, thank you, Deborah, and thanks to everyone for joining. And yes, I've been with Canopy for almost 9 years, but I have been in sort of the client engagement and business development world for quite some time. And just about 10 years ago became an integrative health coach. So really the shift of my career. So it was really exciting and challenging, but it's all been great. And I really can't thank Canopy enough for sort of helping me with that transition. I help them a lot with their holistic health and wellness information. So I do presentations for them. I write on the blog about health and wellness. So yeah, we try to make it holistic at Canopy. That's really the most important part about when we think about our health and wellness. It really is all encompassing and very holistic in nature. Before we kind of get into the mix, I just want to jump right in and ask questions and get everybody sort of thinking about what their experience is with an EAP. Do you currently have EAP coverage? I'd love to hear from anybody. Uh, if you chose your EAP, what went into the decision in choosing your particular EAP? Because what I put on the slide is really the goal of an EAP, right? There's a purpose to it, and it's really to help employees sort of integrate and have the best experience they can have while they're at work, even though they're experiencing other things in their life. And so I would love to hear about some of those thoughts. If anybody wants to jump in about if you have a current one, is it working for you? What was the decision behind it? Thoughts?
Remember, you can use your space bar to unmute yourself. I've got a message coming in the chat box that says we have local 16 sheet metal workers. So that's part of their
Yep. You,
union, right?
yep.
And Canopy is the
Yeah.
EAP.
Yes. Thanks for joining and letting us know. Anybody else? So
Yeah,
there's
we
lots.
use Canopy over here. We've used it several times actually.
Oh, good, good. Hopefully it's been a good experience and we can talk a little bit about the challenges. We're going to be talking about challenges and things that are happening in the world today.
Yeah, most of our employees, when I recommend it and I hand them the flyer, are pretty relieved and excited to have a resource. So
Excellent, excellent.
Maybe
Yes,
we should
employees,
just,
go ahead.
I was going to say, maybe we should just ask the question and put it in chat box. If you do not and do not have, and you can send me a direct message. You don't have to share it with everybody if you'd like. So just hit Deborah. Because, oh, I guess, on the chat box it says HR answers. But just, do you have one? Do you not have one? Because that
Mhm.
might also help Michelle a little bit.
There's really a lot of different reasons why people choose a particular EAP or choose not to have an EAP. Some people and organizations will go forward with using their embedded EAP, which is usually provided by your medical carrier. So there are lots of choices, and that's one of them. Sometimes there's not an embedded EAP, or the embedded EAP is not enough.
Right.
Sometimes medical health coverage is not offered to employees because they're part-time. So an EAP that's independent would fill that gap. Sometimes employees are asking for more. We're definitely seeing a lot of that. Employees are asking for holistic health wellness and wellness benefits, and the EAP can be brought to them in a way that is holistic. Uh, Financial needs, whether it's legal needs, housing needs, there's so many aspects to an employee assistance program when it's being used in a way that's really going to be helping them have a better experience.
Mhm.
Anything in the chat you wanted to add?
Yeah, absolutely. There's a couple of people have an EAP and it is Canopy.
Oh,
A
wow.
couple of people have two services that
Yep.
are embedded. So one's through maybe their medical insurance and provider, and then one with Principal Life.
Yes.
So being able to kind of have multiple options and coverage, and depending on how those two come together, I'm sure there's
Yeah.
also an element of how much service, how many hours, the double benefit. And
Absolutely.
oftentimes, I had someone who just shared with me not too long ago, they didn't know that their family could be covered. So
Yeah.
that was a thing. And then we have one who's through MODA. So
Mhm.
that's probably through their maybe through their health. insurance direct. So that's what we've got going on in the chat box.
That's great. I like the variety there too, right? Because this is going to give us an idea of different perspectives on an experience about how the EAP may or may not be helping, what areas that are of most need, and do you even need one? Maybe is sometimes the question, or do you promote it, or are people using it? Because a lot of embedded EAPs will not provide utilization reporting. There is a HIPAA component to this that comprehensive reporting can't be shared unless there is 75 employees or more. So Canopy is bound by that same HIPAA compliance. So getting past some of those compliancy issues and making sure that there's some utilization that's actually happening and people are using it, those are all really key components. But I will say, it's not just about, reduction of medical carrier costs by using your EAP, because it does help with that. There are so many reasons why it is so important to sort of incorporate the EAP in the benefit in your benefit plans. And I put some, I love data. So I put some data on the screen, and I actually have a lot of data. I don't know if everybody wants to sort of data load right now, but I know we're hearing a lot of the data out there, right? We're getting a lot of percentages about employees having a problem with burnout, with stress, with isolation and loneliness for all of those that are working full-time remote. There's also just this idea of perception. Are they fulfilled by their job? Are they getting their needs met as far as autonomy? And those things that are really important to an employee that aren't necessarily top of mind for an employer, because it is about business, and you're trying to make sure that everybody in the organization is getting their needs met. But I wanted to give you a couple of statistics, and then we can kind of jump in maybe to your thoughts on some of these numbers. So in the American Psychological Association Work in America survey, they reported that 77% of workers have reported experiencing work-related stress often. That's a big number. 67% of employed adults report experiencing at least one workplace burnout symptom. And those include things like just lack of interest, that sort of presenteeism aspect, low motivation, low energy, and loneliness. So that's, again, going to be one of those components that really can be burnout related if you feel like you're having a singular experience, right? 65% of employed adults noted their work stress has negatively impacted their relationships with family and friends. That's huge. So as you're sort of listening to employees or watching what their experience is like, I'm sure these symptoms or what I'm speaking about are really resonating. Probably the numbers might be a little shocking, but it is important to be thinking about the overall holistic experience that employees are having. But I don't want to forget leadership too, right? You folks as benefit managers, HR leadership, you're getting a funnel of requests from top, and you're getting the pushback from people that are in the workforce. So everybody's trying to get their needs met, and it's sort of like, how do I help all these people? So I feel for your experience also. 80% of managers understand it's part of their job to support worker mental health, but only 30% have been trained to support mental health in the workplace. It's a big one. And I will say that Canopy can help with this. We are, one of our biggest roles is leadership training, mental health support and response training. So we can help teach and educate. That's not every EAP. So that's one of the differentiators that really can be very impactful with having an EAP that can support that. I want to hear, I mean, you can put it in the chat too. We can make this a little bit of a quicker one. Do you get push from your C-suite about the ROI of your benefits? Are you getting any sort of like, do we really need this EAP? Do we really need this other benefit? Because that can be a big challenge in sort of keeping the EAP present and accounted for, basically, because that's one of the biggest KPI factors, right? And you let me know your thoughts in the chat. I will say that Canopy, we've done some due diligence. Our ROI is basically $5 for every dollar spent. So it's a really good percentage. I think that's another one that leadership can sometimes struggle with because they aren't getting some of these numbers. They don't know how their money is being spent and if it's actually making an impact. We've actually done some more due diligence, and Canopy's KPI is around 99% satisfaction rate. We have a 50% reduction in absenteeism and 30% increase in focus and presenteeism. So these we do every year. We do a quality survey so that we can make sure that the counseling, the coaching, the financial coaching, all of these benefits are actually showing that it's making an impact on employees' lives, which of course will help the company in return. Any thoughts?
So I will tell you in the chat box, and
Yeah.
please feel free to unmute you guys so that you guys are having part of the discussion. A couple of people weighed in and said no pushback, right? That they're supportive. I did get one message that said they're getting pushback on quote overall cost of benefits,
Yes.
not specific to the EAP coverage, just in general. And
Yeah.
there's no doubt that um, costs are changing and for a variety of reasons. And so being able to be thoughtful about that and keep in mind, I know we're not having a compensation conversation,
Yeah.
but this is part of quote total compensation, whether people are necessarily using it or not. And I did put a note in the chat box about, are you providing training to supervisors and managers about like when to resource the EAP or how to kind of bring it up or any of those kinds of what are the benefits and things that are covered? Because it would be kind of part of my opinion that a good portion of the employees might be talking to managers and supervisors or even other employees. So
Absolutely.
a benefits fair or, you know, notices that go along with that electronic paycheck or whatever it is to keep reminding them that's even out there. So if the managers and supervisors don't know and they're the front line to our folks, we probably need to put something in place for them to help continue that message.
Yeah, excellent point. Okay, we're gonna move forward. I can't wait to talk about trends, again, data. But I would love to hear again from you all about what areas that you're hearing about from your communities. What's sort of the constant thing that's being brought up? Are you hearing more about things like financial concerns because of the news and the state of the nation, and or is it more so about things like burnout and stress? I'd love to hear your thoughts. Absolutely, like Deborah said, please feel free to come off mute or drop them in the chat. I definitely know that we're hearing a lot of different things on our end, and some of them are different than what we've experienced in the past. But I'd love to hear your thoughts before I jump into it. Okay, well, I'm going to jump into it then because I love to talk data now.
We're
Okay, yeah.
trying, we're
No,
trying.
it's all good. It's all good. Well, I've got a lot of information for you. So, yes, stress and burnout is still sort of that catch-all right now. And I'd say previously we've heard the words anxiety and depression, but again, the stress burnout can result in anxiety and depression. So they're somewhat intertwined, and especially when we look at things like utilization. People don't necessarily see a counselor for burnout. They see a counselor because they're anxious, and that makes them feel heavy and sad and depressed. It can lead to depression. So again, these are sort of intertwined, but that's a huge number. And I'll give you another one. The Center for Research at WebMD Health Services found that 1/3 of employees experience persistent burnout, and that burnout rates have increased nearly 25% from 2022 to 2024. That's a huge jump. That's, I mean, a really huge jump. Can we think about how the pandemic rolled into things like hybrid and full-time remote, which leads to loneliness and isolation? We've seen a lot of turnover of management. So you have new managers that have never been managers before, which have a huge impact on employees' well-being, both self-esteem, at their perception of their autonomy and things of that nature. And so we've been doing at Canopy a lot of training with managers to get them at that level where they can lead well and lead responsibly and lead with the mental health aspect of that. So it's so important in thinking about how your EAP can help with this. It's not just counseling, it's training your managers and leadership. And it's online training also. We also have coaching for things like career. Maybe they want to get that promotion, but they didn't. So how do we help them? Send them to Canopy. They can learn through coaching how to increase their skill sets so that they can get that promotion. So there's so many different ways and so many layers to an EAP. And again, not all EAPs offer this. I can speak only directly about Canopy's services, but I am giving you statistics as a whole in regards to how EAPs can service you.
Michelle, I
Yeah,
was thinking that your comment was persistent burnout. So
yes,
this is me
yes,
being nitpicky, and I'm
yes.
not asking you to have an answer, but when people say that, what's the definition of persistent?
I
And
suppose, oh, go ahead.
oh, no, go ahead.
I was just going to jump right into chronic. So when we think
Oh,
of
there you go.
like chronic disease, it is like consistent over time, right? So you can feel it's sort of like a perception of stress. You can be stressed out in a moment, and you know that stress is going to pass, and you can manage that stress and that perception. Stress is sort of that constant, consistent stress that turns into overwhelm, and then becomes again consistent and constant, and you never know when it's going to end. You never know when that workload's going to subside. You never know when you're going to have some locus of control over your environment, your job duties, your timelines, because maybe you're working a lot of overtime. And where's your reward in your efforts? Maybe you never saw a promotion you felt you deserved, but you're putting in the time and you're doing great on your reviews. So those things are that go ahead and add to that persistent burnout, because if you feel like you're sort of spinning your wheels and you're stressed and anxious, then yeah, that's where that persistent kind of burnout happens. And I do think some of that is a result of even the pandemic, as we think about how it's rolled into year after year affecting people. We're still actually in the throes of post-pandemic sort of management. And then, of course, we have all these other things too that we're dealing with.
Well, and I will bring this up only for myself as a observation is what is our definition of burnout inside our organizations? What are we saying defines that? Because I think that there's maybe a little bit more generalization of burnout as opposed to I just can't even get out of bed in the morning. I can't even focus. I'm not who I was. That burnout is complete exhaustion, complete, I'm not able to function versus feeling overwhelmed. What part is the overwhelming? Because one of our notes in the chat box is a couple of employees lost spouses.
Yes.
That is significant. Your life changes. The stuff you have to handle that you didn't before. How do I do that and still show up to work every day and stay focused on just quote the job, let alone I'm responsible for the people in some fashion or another. So, when we have significant events or how do we truly are defining um, burnout? And one of the comments in the chat box was, I'm not really seeing things until I get a request for time off, protected leave because of mental health. Now that I think we've got it waited too long, right, for some support. So being able to think about how is an individual defining that? 'Cause I'm not sure if we'd all be on the same page, but maybe that's just me.
No, I would really agree with that. I think, and it's also fluid, right? I think that what we thought 2 years ago, what was happening and affecting employees has modified. It's sort of gone and morphed, and that will continue to be the case. So we may be calling it something different, but again, it's sort of a layering and intertwining. And it's sort of having, and it's a lot, right? Most of the time people are sort of like, hey, I never signed up to be a mental health counselor. Why do I have to like do this? And fair. And so a lot of the training that we do is to help identify those precursors that could be showing up, whether it's absenteeism or just sort of that low productivity. And instead of approaching it in a way that's, something's wrong with this person, no, it could be something's happening at home and we don't know about it. So let me get some services. Have you thought about talking, to Canopy about what services could help you out? I'll talk a little bit about some of the trends here in a moment, but I wanted to talk a lot about that stigma. The stigma is still there too. So we have the challenge of breaking down barriers to talk about mental health in a way that is normalized, and that we're not there yet. And I can say that as an EAP representative, we're still not in a space where it's just super easy to talk about mental health in the workplace and feel safe and feel like it won't affect your career. So we're still not quite there. So it's just best to blanket information about this is Canopy. They can do this, this, and this, and this. That's really how we promote it. We promote it with beautiful colors, great imagery, trying to make it seem this is normalized. If you need it, it can be this, this, or this. So a lot of it has to do with consistency. It has to do with messaging visually. We are very visual, like human beings are so visual. And of course we have to deal with things like the amount of span of attention people can offer these days also. So it has to be quick and easy. And consistent, really.
Well, ditto, ditto, ditto. And one of the things is, we're talking about mental health, we're talking about safety in a variety of ways. One of the notes that came into the chat box was uh, urban camping. As someone shared with me a way to call it, the houselessness activities, that this is happening directly across the street from them, and they're seeing drug use and fights and guns being pulled. So being able to think about the employees have to park a fair amount of ways because even the parking lot has been taken over. And so this is causing people to have all kinds of emotions about what's going on, why it's going on, how to make a difference, or how it's impacting them or showing up to work, let alone just being scared in general. And so I'm sure that this individual is not the only one who perhaps has experienced that or has seen a little bit more of that close by their workplace and having an impact.
Yes, vicarious trauma is real. I mean, just because you didn't experience something firsthand, if you watched it, it's traumatizing. And we do a lot of our crisis support in regards to things like that too. It may be something that they watched. It doesn't even have to be somebody they know that experienced violence that is very traumatizing. And then if you are kind of layering it in the sense that every day you go to work, you might have an experience. Can you imagine how anxiety inducing that would be? So having that regular check-ins with your EAP about how do we approach something like this? Is there anything we can do? Do we, because you don't necessarily want to rely on that crisis support. A Canopy offers it, and we have a lot of different ways we offer crisis support, but a lot of times crisis support is reactive, right? It's something that's happened and now we're responding to it. So what can you do that's more proactive? And there's a lot of questions to that, and there are some solutions, but it's a lot of times it's just about learning while you're having the experience, unfortunately, because it's not something that we're used to experiencing. Yeah, that's I think that's such a good segue. So let's go into the next slide here too. Because I do want to talk a little bit about what else is happening out there. And I would say we are seeing a lot of different things also. I have on there organizational support crisis. I'm actually going to give you some numbers here in a couple of slides from now about what Canopy's experienced as far as crisis support. But we're also hearing a lot of different challenges around sober curiosity. And that means when we're saying that, we're talking about people that maybe didn't think they had a substance issue, but now they might believe that they do. And why is that? And they're asking questions, thank goodness. It's not that they're necessarily having people come up to them and saying, I think you have a problem. It's more so, hey, I didn't used to drink on the weekends, or now that marijuana is legal, can I dabble, and how much is too much? So people are, I believe, and what we've kind of looked in the data is that people are trying to find ways to cope. And sometimes that goes to substance, and it's not a great coping mechanism, right? It can lead to bigger problems. And of course, Canopy and other EAPs can assist with substance misuse and help people manage and move through that. But it's not easy, and it's really interesting. And so our goal is going to be really looking at how to create sort of toolkits and a protocol around from beginning to end when it comes to somebody who's going through a sober curiosity experience or a journey. Another thing is dependent care. We have so many people moving through the that sandwich generation, right? And it's those people who are taking care of an elderly parent's needs, and then taking care of their children and dependents' needs. Serious emotional strain as a caregiver. You get that compassion fatigue. We've definitely been helping people with compassion fatigue. These people have a higher rate of burnout and depression than other caregivers. So you might have people that have dependents at home, but you might not even know you have employees that have their parents living with them, or are having to navigate the elder care facility system, which is, I've done it for my grandmother, and it is overwhelming to try to do that alone. So most EAPs can offer an element of assistance. I know that Canopy, we have a complete elder care process that we help people through and get them through to manage that. I'm sure it resonates with people right now that are listening, because yeah, it's never been more than now. And the other aspect of that is the financial challenge, because 80% of these people are incurring out-of-pocket expenses for their elder care and childcare care. So can you imagine paying for 80% of your elderly parents' facility while also trying to save for your kids' college fund? It's incredible out there, like what we're sort of working through right now.
Yes,
Um,
I've been
yeah.
in that sandwich.
Yes.
And I
So,
will share with you, in full disclosure, everybody, one of the times that I utilized our EAP here at HR Answers was when my dad became ill, and it was going to be a completely different kind of scenario for the family. And so my mother, my brother, and I all went and utilized the EAP to have a conversation. One, navigating our own emotions, and they were all completely different in terms of what we were personally experiencing in that regard, but then how to care for my dad. And so having someone to talk to that, in some respects, in all seriousness, helped us facilitate our necessary and needed conversation. We had been doing some of it, but not to the level it really needed to happen. And it is an example. My dad's been gone for 10 years now, but it is an example that I constantly reference when I have the opportunity, because it made such a difference to have even that level of support to help guide us in our own thought processes. So for what that's worth, just three
no,
thumbs up.
that's a great example, right? And when you think about the different, especially with an EAP, again, it's a layering of benefits. You could use it for family counseling. You can use it for financial budgeting. You can use it for elder care assistance, for finding a facility or moving your elderly parent across the country. Because people are doing that. They want their parents closer to them, so they have to move them from Florida to Oregon. I mean, how that's overwhelming to even think about having the process of that. There are ways to get assistance with all of that through an EAP. And again, not all EAPs are offering this full scope of benefits, but it's one of those things that I like to think that an EAP really should offer, this robust, holistic services. And it should be like a menu you can choose from, and then you have lots of different options to choose from. It's really the best way possible. Okay, before we go into, I just want to ask, actually, I'm going to back up because I did want to ask, has anyone sort of had the conversation, and you can just put in the chat to Deborah, but what Canopy's hearing is a lot of conversations around reduction in force. So there's requests for things like, how do we communicate? What can I offer them? What about the people that are still here? How does management discuss this now and then also have those conversations later? So we're definitely seeing a lot of it. We heard so much about it that we put together a lot of materials that are really about having those conversations. Here's what you would offer this employee. They have 30 days to use the benefit. They can get career coaching. They can use the financial coaching to get themselves sort of in a space. They can also use counseling to assist them with sort of reframing, because a lot of times it's so difficult to get somebody to see beyond the loss, and it is a loss. A job loss is a major loss. And having a behavioral health counselor be able to, yes, validate this feeling and help them shift gears so that they can now look at things proactively with forward momentum, so that they're not having to sort of relive that experience of the loss. So it is very serious, and we look at it that way to be able to provide information for everyone in the organization, from organizational perspective to the people experiencing survivor guilt to those people who have been asked to leave. And those are all things that are validated.
Yeah, I would echo that survivor guilt. And
Yeah.
no one put anything in the chat box either.
Okay. Well, just curious if anybody thinks they have some myths about EAPs. I'd love to hear just thoughts. Like, honestly, it's probably one of those things where the first thing people think about is really it's not safe to talk about in the workplace, and I'm going to call it a myth, and I'll tell you why. But also things like it's not private. That's a big myth around an EAP. There's that my employer is going to find out. And we know that's a myth because, again, we're bound by HIPAA. Also, the EAPs are sort of, and no offense to embedded EAPs, but there's sort of the stigma around an EAP being a little slower, not as technology based, not innovative. And there's a lot of technology out there, right? And so then we have the complete opposite of an old EAP mentality into this new digital phase. But then the digital phase is no human element. And so you have no way to find out what's happening with your EAP. If there's a problem, who do you talk to? So it's really these both sides of the coin here as far as how it's being perceived, because there's a lot of innovation happening in EAPs. There should be both a human element and a digital element for sure, because we live in a virtual world. We need virtual, but we are humans. We need human touch, or at least the option to have that engagement if you have questions, so you don't get extra frustrated, because it can be frustrating to move the process. I've been to counseling before. Canopy has an EAP, and I've had both good and bad experiences. So it's not to say that EAPs are perfect or that they're a catch-all for everything. So a lot of times it's about educating people to make sure to ask for what they need. That self-advocacy for your health, both mental and physical, so important. Some of the things we just don't feel comfortable asking for. And I don't want to stereotype too much, but I know that women have even a harder time asking for their needs to be met. And so having that sort of barrier even more enhanced through each individual experience it's problematic for sure. Utilization, I will say, I don't know if anybody can speak to it. If you want to put in the chat, what are the utilization expectations? There's this idea that if you're not using your EAP and getting 75% utilization, your EAP isn't doing well. And in reality, the average EAP nationwide through all industries is about 5%. it's pretty small, right? Canopy is around 8. We see embedded more around 3. And to give you some context, medical carriers averages around 14. So it's not going to be a huge number. It's not going to be this massive number to have an expectation. So it's a little bit about learning what is a healthy utilization, so that if you do have leadership asking you for numbers, you can let them know this is actually healthy utilization when we're getting 10% or 12% utilization. And you can look and see what they're utilizing, and then you can work with people to enhance that experience. I will say this is probably myth, maybe also fact, is that it can be hard to implement, right? You launch a program, you want to launch it and forget it, but that's not going to be a successful EAP. You can't just let it ride on its own. EAPs have to be like anything else. Think of marketing in a scheme. You have to hit people 7 times for them to remember something. And so marketing as a whole, they layer it, right? You layer it with visuals, you layer it with flyers, you layer it with a physical collateral, reminding them all about their EAP. A lot of times people will integrate their EAP with their DEI initiatives and committee, or their wellness committee, if you have one. I know that's probably for larger organizations that can have that aspect of it, but it can really help for those 3 committees to work together to sort of create that outreach. And then,
You
of
know,
course, yeah, go ahead.
I was going to say, Michelle, I would like to share 2 observations that were shared in the chat in
Oh, yes.
regards to that,
Yes.
and have you guys thinking about how are you promoting, educating, providing information out there? One person posted they actually have posters, materials at their door, I assume HR door, and they can come and pick one up. I actually have never heard someone having it at their door so that people can just grab it as they're going by. So I love that. The other one shared, uh, posted in all the restrooms. Yes,
Yeah.
on the back stall door
Yes.
that we're there
I'm
for a moment
sorry.
or
Yes.
two, little reading, but also the employee lounge,
Yeah.
HR. So, and here's my little tidbit for you all. Please keep in mind when we have those things posted and they become kind of part of the wallpaper, as it were, my word, we don't see it anymore because it's always, quote, there. So change up where you're putting it. Move it at once a quarter, every month. Change the color of the paper if you're posting something. Change it up because it's going to also be about that 7 times. I might suggest it's even more than that. Being able to get people where they're at. Is it around their paycheck? Is it around texting? Is it in email? Is it in the restroom? Is it in the lunchroom? Does it come to their home? Is it in their workspace, station area, out on the in the field, in the trucks, out on the floor, wherever that is, keep changing that up because our employees are not all gathering in the same place. They don't all pay attention to the same thing. And if we keep changing it up a little bit, it's not that you can't be in those places. Keep adding or make some rotation or be intentional or put that big arrow or something to be thinking about. How do we keep them in the know? Because I think it can be like the old days. Again, I've been around the block once or twice, where we used to put stickies around our monitors when there was enough room to do that. You don't see the stickies anymore.
Yeah.
They just kind of become there. So I'm just suggesting think about what else we can do. And it doesn't have to be you thinking about it. Ask employees where they pay attention or are seeing things. Where would they like to see that information?
And ask your EAP to provide you new things. Like with Canopy, we do send our newsletter. There's always a new flyer in there for you to download and post. Our flyers will have QR codes. So if somebody's in a private space and wants to scan the QR code and go, they can. Yeah, we have an online library that has all of our materials so that that leadership can go in and download new. We are constantly adding to it, and I'll talk about that here in a moment. But yeah, it absolutely has to keep you fresh. That's kind of why we use visuals that are interesting and fun and are really meant to add levity to the situation, because mental health can get a little heavy, right? And then we have to talk about your challenges, obviously. I mean, these are challenges specifically to an EAP providing mental health support. But just your challenges. What are your challenges this year? Give me your thoughts in the chat, or come off mute, because yeah, there's a lot out there as far as expectations, getting people to use it, reiterating that it's confidential and private so that they do use it. You have 4 generations in the workforce right now, and that's intense. So we hear a lot about Gen Zs falling behind in that sort of satisfaction. So having to keep them engaged. There's DEI or not to DEI. There's compliance and labor laws changing constantly. I know that we went through the whole back to the office, hybrid, work from home. What are we all doing? It's like, and how is it affecting you? And we probably won't even know the full effect for probably another year or two. So it's just really difficult when you think about your experience as benefit providers, HR, leadership, and the challenge of sort of getting all of this information out. But it's so worth it when you think about how getting these services to people, having them use it, having them feel more empowered, having them have a financial issue get resolved, having family counseling, and having your child feel less anxious or depressed. Those are so satisfying if you can get that information out. So it's just so worth it to continue to like lead and charge and make sure that it's happening. Yes, and the mental health saturation, I did want to kind of touch on that, because there's a lot of people using counseling. So we have a saturation point a lot of the times with finding counselors to manage the influx of need. But I will let you know, Canopy, we are recruiting every day, every month. We add new counselors to our list of providers. So it's one of those things that we will continue to work on.
You know, it's not interesting. When you say that, one of the things that I think sometimes can come up for people, back to kind of your myths is, are people going to be sharing this? Will people be in the know? How does that look? One of the things that I think is so important about this, if we remember, there's an element here of the the human business. This is human to human. We care, right? So whether it's a manager supervisor, whether it's HR, we care about you, and I will just tell you, as someone who provides a great deal of training to others, happy employees make productive employees. So if they're going through something, to acknowledge that we hear you, we see you, we value you. And this is a great way of being able to reinforce that message. So much, in fact, that someone put in the chat, they've already sent 5 employees a message right here during this lunch bunch because something struck a chord with them.
That's awesome.
That's
Oh,
totally awesome.
that is fantastic. Yes, I definitely think that you will be advocating for this, and you really are, unfortunately, but fortunately, the catch-all to be able to spread this news and get people using it and informing them. But then it will work out, because those employees that start using it are going to tell their friends, and then it just sort of rolls into the next. And so they become the advocates too. So it has been great to be able to do that too. I am going to go into organizational, just in lieu of time, I want to push forward a little bit. Now, not all EAPs offer organizational support, but I wanted to highlight this because I think it's really important factor, because this is the proactive nature of things. We don't want to always be like reactive, right? We want to be offering leadership training, so your new managers can feel like they can articulate well and provide the resources in a way that they're confident in, or customized collateral. I mean, we have so many cool materials. I got to say, our marketing department is amazing. If your EAP, maybe they have a little ho-hum, because we had to get out of the ho-hum phase too. We were ho-hum, I would say, even 5 years ago. So we really stepped up and started to make things a little more interesting. start asking for those things. If your EAP doesn't have a lot to offer, just ask them, hey, do you have anything fresh and new that I can give my employees? But that's something that we do. And we also have assigned customer success managers. So I am a customer success manager, and I have a lot of groups that I serve. And that is so great to be able to say, hey, instead of calling 800 number and say, hey, I don't know what's going on, but I can't get this done, or I need this, or there's an issue, they can come to me, which is so important. It's just that human touch, that human element that's so important when you're trying to promote and navigate mental health in the workplace, is to have sort of an advocate. You can work with your customer success manager. And that is also, not every EAP offers that. So it's one of those things that really differentiate Canopy. Our responsive approach is definitely critical incidents. We had over 320 requests for crisis support last year, 320. And those include things like employee death, a death related to employee's line of work, violence in the workplace, vicarious trauma. So all of those things are happening, and Canopy can respond. And I'm curious just if your EAP doesn't offer that, or do you know if your EAP offers that, or if you have another service vendor that provides that? And if it was helpful. One of the things that we're doing is we have different types. We have virtual support, we have on-site support, group one-on-one counseling, and it really varies. So we have a crisis support team that will speak with the client, the contact of the organization, and go through it. Let's talk about what happened. And I'm going to give you my counselor's perspective on what we should do next. So it's really, again, having a mental health advocate to help navigate some of these higher stress needs that might be happening. And then just consulting if your people need mental health information. It's just nice to be able to come to your EAP and say, hey, something's happening in the workplace. I don't know what to do. And Canopy can help with that. And a lot of times we're helping with a lot of things other than mental health, interestingly enough. So it is nice to just have that advocacy there. I just wanted to show a few things of what Canopy does. This is sort of that response to current events. So we had a lot of people reach out around the time of immigration concerns, a lot of people. So we really felt, we jumped on it and just decided we gotta create some materials. So we have a lot of materials that are really about solution centric, about information and education. So we are constantly creating these when we see things happening in the world, so that when our clients contact us and say, hey, I have a lot of employees asking about concerns with immigration and legal services, literally that same day, we can shoot them an email with a bunch of resources on how, and then they can pass it along. So it's that quick sort of proactive thinking to create these things, but also responding and helping people in that real-time need that they might have. Okay, I just want to be cognizant of time, but I do want to mention this story. It was such a random story, and these stories can be sad and they can be really good, but it was a really interesting circumstance. We had a client, a member, so it was an employee who was in the middle of a divorce, and this member, she decided, I'm going to take some online courses that are on our member website. So she took a bunch of online courses around parental care, how to prepare your child for divorce, and each of our courses and webinars offer a certificate of completion. So when it came time to get in front of the judge and determine who was going to have custody and how much, and all of those parameters, she gave the judge her certificates of completion for the courses she took on how to help her child. And unfortunately, her partner did not have anything to show. And so the judge was like, you have clearly prepared yourself for helping your child have a better experience, because divorce for a child is never going to be easy. But having this experience where you educated yourself, you took that time to do this. So yeah, that was a big one for me, because it's not counseling specific. It's not financial need. It's not immigration law. It's such a relatable experience for many, many people. And it's a free online source with Canopy as an EAP source. Most EAPs do have online resources. So you might not even know that. And so you can check them out, go online, let your employees know, have you checked out all of these online services and resources and things you can download? It's a great training tool for employees and managers also. Okay, well, that is really kind of all. I wanted to leave some time for some questions too, but I did want to just sort of let people know, yes, I know you already know you want to lead by example. You know, you're trying to reach out to your EAP and spread the word. I would say speak from the heart. If you've experienced things with the EAP, tell your story, because I think that resonates with people. They'll listen more. And try not to just give them a card and send them on their way. Like maybe a little bit more of a warm handoff, so that they can feel heard and seen and validated, because that will help with things like the burnout or the autonomy, those types of things where people feel like they're just not engaged because nobody's engaging with me. But the other thing I would absolutely wanted to say before we wrap up is just to remember, take care of yourself while you're taking care of everyone else. I know that benefits and HR and people operations, it is just such an intense job. So I just like to let all my friends, because I have a lot of friends in HR, know that they deserve balance and health and well-being also. So you got to reach out for help if you need it also. So you don't need to push through things alone. So you have your EAP also. Please use it, and reach out for help because you need it too.
I'm glad you said that.
Yeah, yeah. And I
Because
do
it's
have
so
some
true.
resources here. I don't know if we're going to send out a PDF or if this will be in the recording, so people could click on this pretty easily.
Yes. Well, and I really like those questions that you asked on the previous slides, and would
Mm,
encourage people when you get the handout or the PowerPoint that you pull those up. This can be part of a leadership conversation. This can be part of a leadership team, executive kind of conversation. Maybe it's one question every so often to keep that alive as a discussion point, and the value that comes with that. Because if we don't if you don't have answers to those questions, you probably want to have that in terms of back to that proactive management component. So I like those questions. And even in my own material, which is a slide that comes after your resources, kind of like, what did you hear today? What do you want to share with someone else? Is there something that you will start working on? Or to the person, kudos that you sent out 5 emails
yes.
during this session, multitasker you. But being able to, what will you start doing maybe differently? Is there something here that sparked something, let alone sharing the information, or when the link comes and ask them to view it? Um, it might just be the opportunity. And again, because May is mental health awareness, it ties in. So I did put in the chat box if you wanted to reach out to Michelle afterwards. There's her phone number. I thought I actually grabbed your LinkedIn too, but apparently the text box will only handle so much information at one time. So with that said, I'm glad that you guys joined us today. I appreciate that. Hopefully there was something here that sparked something or reinforced what you're already doing. And feel free to, if you're sending private messages to each other on the back end of this, feel free to connect and reach out and network with other people. I think that that's a valuable component of our discussion too. And Michelle, there was some good information, some good data, and it sounds like there's even more data out there. And
Yeah.
if I can just reinforce, sharing our own personal stories, that helps get rid of one of the myths of a stigma, and how robust the offering can be, that we aren't alone in a lot of these things that happen. Life happens to all of us. We all respond kind of differently, and this is a terrific resource. And even if we don't have an EAP, one of the things that I think is important for you to know, I know this is true for Canopy, it may be true for others as well, you don't always have to already have a plan in place or a program offering. If there's a situation or an emergency that pops up, there is the one time kind of occurrence. And I will just reinforce that one of our clients had that happen, and they reached out and got the support for the employee base after an employee and her family all died in a car accident. And it was extremely unexpected. It hit everybody differently, and it needed to be dealt with and handled and supported immediately because it was a big shock and surprise. So those kinds of things do happen. So know that even if you don't have something in place, you can still have support should something happen inside your workplaces. And if HR is bringing that to the table, that just gives us more value as what we bring to the table for our organization and the employees, because it matters. It matters. So thank you so much for all of you being part of this one. Michelle, thank you for joining me. I really, really am glad that you were able to do that and make time for all of us. And as you can see on the screen, we've got some upcoming topics. So if one of these resonates with you, or you can share with others inside your organization, that I encourage you to join us. It's always the first Wednesday of the month. It's always at 12 noon Pacific time here on the West Coast. So look forward to having you and seeing you again in the future. So for this one, I will just let you know that we'll call it an official, we're ending, and this is our stop the recording so that you can move along on your day, and hope that you have a good rest of the week, and we'll see you next time. All righty. Thanks so much, everybody.
Thanks again. Take care, everyone.
Take care. And I believe, Michelle, you'll need to hit that button for me.